Hi everyone, my name is Dr. Parky. I'm a postdoctoral fellow at Stanford University School of Medicine on the psychology side, and today I'll be talking about some tips for being a strong applicant for clinical psychology PhD programs. So give me a moment while I share my screen so you don't have to look at my big silly face for too long. So when it comes to being a competitive applicant, research experience is king. And what I mean by that is that research is kind of the big thing that most programs really look for to make sure that you are a good fit for their program. So they're kind of wanting you to come into the program already with a pretty good foundation when it comes to research and especially your ability to perform graduate level coursework. So are you able to conduct literature reviews, identify gaps in the literature? Are you able to come up with a research question in a nice, elegant way to test it? Can you conduct statistical analyses to be able to test your questions and produce results? And then take those results and disseminate them into conferences and manuscripts. Are you able to kind of basically go through that entire research process? Now, obviously, they're not looking for you to be like an Einstein when it comes to your ability to perform research, but they do really want you to have this foundational ability to conduct graduate level coursework and be an independent scientist. Now, the question then becomes like, how do I get that experience and how much experience do they actually want? So the age-old question of like breadth versus depth. And the sort of annoying answer to this question is that it's a little bit of both. So my encouragement for you would be to join maybe 2 to 3 research labs and spend at least a year or two in each lab to really get a sense of what kind of research they're conducting and sort of the ins and outs of the research process. And I think this is important for a couple of different reasons. The first reason is that being in multiple different labs allows you to develop a unique marketable skills, especially if you're spending a fair amount of time in each lab, because your professors or mentors or other graduate students are going to be like, okay, like I can really trust, so and so with the sort of research process. Maybe I can give them some more independent tasks to do. Maybe I can give them the lab manager positions that then allows you to really cultivate, a lot of skills beyond just, yeah, I was a lab tech monkey who was entering data and then I left after 4 months. And then it also allows you to develop more research interests that are more nuanced by nature. Like if you're in a couple different research labs, in one lab you're focused on relationships, and another lab you're focused on anxiety, then you can kind of come up with sort of like an intersection nuanced question of like, well, I'd be kind of interested in understanding in the context of relationships, is it a protective factor for mental health depending on a person's general neurotic tendencies? So does anxiety play a moderating role here? So you can kind of really come at it with an angle of nuance and understanding that goes beyond if you were just in one lab for 4 months over the last 5 years during your undergraduate degree. Any other piece of having some amount of depth along with breadth is that it allows for very strong letters of recommendations. You can really have your professors come to bat for you and say, hey, so and so was just like freaking fantastic when it came to their ability to conduct independent research. They did X, Y, and Z. They were able to take these data that we had and then do some analyses and they present it at a conference. So it really can set you up for success for somebody with a lot of clout, a lot of like hold to be able to say, hey, like so and so can really do a really fantastic job of being an independent scientist, which is exactly what the programs are looking for. So besides research, the other thing that people are often asking questions about are like clinical experience. And actually, clinical experience is significantly less important when it comes to a PhD program in clinical psychology as compared to research experience. Most programs have this sort of train of thought that they can train you to be a clinician. They have their own modality that they're interested in, like cognitive behavioral therapy or humanistic or psychodynamic, and they can get you to where they need you to be. But they want you to be a relatively independent scientist. They want you to have at least the foundational skills. They'll still train you. Obviously, you'll have an advisor. The program knows you're not going to be, amazing coming right out of the gate. You're not supposed to be publishing, the moment you come out of the womb, but they want you to be generally, again, independent as a scientist. But some amount of clinical experience can be helpful. It's not a bad line to have on your CV, and it can be certainly helpful for you to understand if you would enjoy the work. And you can do that in a number of ways, like working as a support worker, you can volunteer at crises hotlines, or, if you're in a research trial as part of your lab, you might be an assessor, so you might get a sense of how to deliver assessments to patients. Next are academic grades. The way that I think about academic grades is that a lot of admission committees use it as a benchmark to kind of decide whether or not they were going to reject an applicant, but that's usually not like the factor they use to decide whether they want to accept an applicant. So obviously, PhD programs in clinical psychology are very competitive by nature. There's a lot of different people applying, but there's a very few slots available. So academic grades can be one way they can say, okay, anybody under sort of, let's say, an A minus in their sort of undergraduate studies, they're kind of called out, and we're just going to focus more on the people who had at least an A minus over the last couple of years of their undergraduate studies. For the people who didn't do so well in the beginning, I didn't do very well the first couple of years because I didn't know what I wanted to do with my life. A positive trajectory can be helpful to showcase that you're kind of really getting an understanding of how to do well sort of post high school, do well in undergrad, and then that kind of can be a nice sign that you can do well in graduate studies. So if you didn't do so well the first couple of years, it's not the end of the world. You can absolutely really showcase the last couple of years that you're doing much better. So the GREs, the graduate record examinations, for the most part, a lot of schools don't require the GRE anymore. In some cases, it's still optional or maybe mandatory in some schools. So it might be worthwhile for you to um, study for it and do well on it. Strong applicants typically have a verbal score above the 85th percentile, and then usually above 80% is ideal in the quantitative math and writing components. Um, Obviously we're in psychology, we're not in math. So there are people who do and just fine getting into programs, even if their math scores are a bit lower. But if you do have a strong GRE score, then it certainly doesn't hurt to submit that. And especially for the people who don't have a psychology background, who might have like was an economics degree, but then they got really interested in psychology, but they didn't do a major in psychology. The subject psychology GRE test can be a helpful marker to showcase to admission committees that you are serious about this and that you have a very good foundational knowledge if your background was not in psychology. So finally, I'd just like to talk briefly about some general considerations for a strong application, and I can go into this more deeply in future videos, but certainly it can be very, very helpful if you showcase a strong background in research and statistics. Like a lot of students, they're not like super great at the statistics part because their math skills aren't like super great. But if you can showcase that you can do all those like analyses like t-tests and ANOVAs and regressions, and that you have some familiarity with these like different programs like SPSS, R, and RStudio, then you're kind of setting yourself up for success to say, hey, like I have this unique marketable skill that's going to really help propel me in the ability to conduct my own research. So, second of that, a strong psychology background. If you're major in psychology, then you're probably already good to go. But if you're not, then doing the psychology GRE, taking lots of psychology courses, that's going to be helpful to showcase you have a basic foundation. And, a sort of softer skill is this sort of interpersonal factor. Like, are you just somebody who is enjoyable to work with? Like, programs are looking for someone who can stay the long haul. They're going through the PhD degree. It's taking 6, 7 years, and they're spending copious amount of time with a mentor. They're going to want somebody who are generally pleasant to work with, who are kind, who are compassionate, who seems like they are quote unquote a team player, if you will, and someone who you would just want to hang out with for the next half a decade. So interpersonally, it'd be helpful to really showcase your ability to be a warm, curious, and awesome colleague. And besides general research experience, you do really want to showcase a good research fit. So, does your research make sense with the person that you're studying? Like your research interest and your research background, is it a good fit with the mentor? Is it good with the program? Does it fit kind of nicely with the squares of what the mentor is studying? And then also, of course, help to extend it because they want somebody who generally have research questions that are a good fit and they can kind of like branch out a little bit to their own unique interest. And then the final consideration is really just to be lucky. Like, obviously, we know that PhD programs, the acceptance percentages are like, in the single digits. So there is going to be a component where you could be absolutely qualified, you could be an amazing student, and you may not still be able to be accepted because that year the mentor ended up getting sick, or they had a medical emergency, or they already had a lab manager of 5 years who's also applying, and you're just, unfortunately, you don't have the same kind of pull as that person. So you're going to want to be willing to apply to multiple programs and be willing to kind of really throw your hat into the ring and accept what might come. But ultimately, you could be very lucky and someone has to get in, and it might as well be you. All right, that's that for this video. And I hope you enjoyed and I hope you got something out of it. And take good care for now. Thanks for listening.